Part 3, how to manage and treat POTS. Now this is the video everybody's been waiting for because there is some really cool new information on how you can actually manage your POTS and how you can treat it. Mayo Clinic, they found out that there is a big correlation after COVID of a B12 and B1 deficiency. Now, here's the cool thing. Celiac MD and the National Library of Medicine have also published that there is a deficiency in B12 and B1, and that plays a part in POTS. Okay, so just reading verbatim here what we have in the research paper. Medical records of 65 consecutive patients with POTS were evaluated, with 62.8% of patients being vitamin B12 deficient, while 6% of patients were also deficient in vitamin B1, thiamine. 1 in 4 deficient patients experience significant improvement of POTS after oral supplementation. Again, Mayo Clinic is finding that B1 and B12 deficiency are common after the COVID virus. So this only adds more fuel to the fire for POTS. So think about that, everybody. If B12 and B1 are already deficient from COVID, and we're seeing the same thing with POTS patients, you need to get your levels tested. Check your B1, check your B12. Now, other levels that need to be tested. Copper. Copper plays a significant role in the development and function of the central nervous system. I personally have struggled with keeping my copper levels up after COVID, as many others have actually had the same issue. Now, copper is one of those trace minerals that it can either be harmful if you have too much or harmful if you don't have enough. So before taking copper supplements, you must get your levels checked, talk to your doctor, and see where your copper levels are. The next thing is folic acid. Folic acid can cause a deficiency of lack of energy, dizziness, and muscle weakness. So talk to your doctor, see where you're at with that too, because that can play a major role in it. Now, the next thing you need to do after checking your vitamin levels is you need to consider what is causing inflammatory markers in your body. Now, to do this, there's a diet. It's called the AIP elimination diet. It's a 30-day elimination diet, and it's an autoimmune protocol diet that is going to eliminate all inflammatory foods from your diet for 30 days. After 30 days, you're going to reintroduce one food group back a day and journal your body's response. If you have a poor response, you're going to eliminate that from your food. Okay, so for instance, for me, sugar, gluten, and dairy were major triggers, all right? And that's in the elimination phase. I was able to add additional foods back into my diet, and it was strange for me, everybody's body is different, but for me, after the elimination diet, I could have lactose-free milk, and I could have white cheese, but I couldn't eat cheddar cheese. It was weird. So everybody's body is different, and you kind of just have to monitor that and see what it is. The biggest trigger I still have is gluten, because I actually tested positive for celiac disease, and sugar. So I'm going to go into that next. Blood glucose spikes can enhance POTS symptoms because it triggers inflammation and neuropathy. So it's best to reduce processed sugars in your diet and stick to natural sources of sugars from fruits. So when I say processed sugars, I'm talking about white sugar, basically, right? That's not good for you in the first place. So try to get natural sugar because it's going to be better for your autoimmune system. Number 2, gluten. COVID is known already to cause severe inflammation to the body. Gluten enzymes can also trigger inflammation. So it's kind of goes hand in hand that you probably should try to at least talk to your doctor, see what they think, and try to eliminate gluten for a couple weeks just to see if you see a difference in your body, right? For me, it personally helps a lot. And a really cool fact here is Celiac MD has stated that all of their POTS patients had some sort of gluten sensitivity or celiac disease, proving a strong correlation between the two. It's important to note that if you do test positive for celiac disease, 56% of celiac patients has some form of an abnormality to the autonomic nervous system. So keep that in mind. And again, you need to get tested for celiac disease after COVID. So because a lot of people are becoming pre-genetically disposed after COVID, you need to see if that's you. So just go to your doctor, get a test, so you can rule it out. Now, you can also have gluten sensitivity without being celiac. I'll make another video on that at some point. Next tip, is eat small and frequent meals instead of large meals. This helps prevent excessive blood pooling to the digestive system from your head and will assist in being able to basically keep you from fainting and passing out. So you need to eat a diet high in fiber, and you need to eat complex carbohydrates that may help reduce blood glucose sugar spikes. Now, the difference between a complex carb and a simple carb: complex carbs will be sweet potatoes, broccoli, green beans, carrots, beans, asparagus, and you're going to want to avoid simple carbs, which is raw sugar, brown sugar, corn syrup, white potatoes, white bread, processed baked goods. Just avoid those. Next step is you're going to want to make sure you drink plenty of water. It helps blood circulation. You want to get a lot of salt in your diet to increase blood volume. You may want to use compression stockings to keep fluid from pooling to your legs. And then a saying that we use in the POTS community is lay flat, head back. If you're feeling really lightheaded, lay down flat for a couple minutes, allow your body to kind of reset, and then gently raise your head slowly and sit to the edge of your bed for a couple minutes to allow your body to adjust. Lastly, once you follow all these steps, exercise is key to getting you back. You have to build your stamina. Now, some exercises that are beneficial for you if you have POTS would be swimming, rowing, or maybe a stationary bicycle if you can, stay on it. These are a couple of the exercises, but you do need to build stamina back, even if you can go for a brisk little walk or something, just to get your body to build some stamina back. You have to do that. And most importantly, guys, keep a positive mindset. It's extremely depressing to have POTS. I know what you're feeling, because for 2 years, I could not get out of that bed. All right. I know how debilitating it is. It's extremely depressing. And we've lost some really good people to this disease mentally. I don't want you to be that person. The POTS community is here. We can help each other. We can support each other. So I want to do that. All right. It took me, like I said, 2 years. So there's hope that you can regain your life back. Do not give up and keep pushing forward. If you're having issues with that, leave a comment below. And people who have been dealing with POTS for a while and you know how to control it, go through these comments as well down below and see if you can actually give some feedback to help these individuals. I want to try to build a community for all of us to be able to build each other up and help each other. So look at those comments down below. And if you have any additional feedback on treatment centers in your area, feel free to leave that in the comment. Or if you have any other suggestions on how you treat your POTS, please leave comments below. But I just thought I would share this information because this is what's helped me get my life back, is changing my diet, limiting the amount of meals that I eat in the day to smaller portions, and checking my levels to see where I'm at. So God bless, and I hope everyone has a great day.